Welcome to my 27-week pregnancy update. I'm nearly a third trimester. It's the last week in the second trimester and I'm super excited. Hi guys, welcome to my channel. My name is Sissy and I'm a mom of 2 and 1 on the way, and this is my 27-week pregnancy update. If you watched my last update, then you must have seen that I was in hospital, but now I'm actually at home and I'm so excited. So I have a lot to update you guys on about. Number 1, in terms of my hospital admission, they actually told me that I can go home. Like, I was really fine, nothing much was going on. I was just living there. So I was there for a total of 10 days, and then the doctors were like, you know, actually you can't just go home if you have no active bleeding, you have no pain, nothing, which is what was happening, thank God, because it was really tough being there by myself. Without like my family. I didn't see my kids for ages. Well, for like 7 days or 6 was the longest before they could come and visit, but that's the longest I'd been without seeing them since birth. So it was really tough. And also being in hospital, and like it's a maternity ward, so around like there's moms coming in with complications. A lot of times people were unwell as well. So for me, I'm lucky that I actually feel fine. Baby is fine. It's just the connection between us, which is the placenta, that has the problems. So if you haven't watched any of my videos before, then I do have placenta accreta spectrum and placenta previa. A bit complicated, but what it means is, in terms of the previa, is that the placenta is implanted at the bottom over the cervix, and the placenta should be implanted elsewhere, like ideally anywhere except there, because that's the way out for the baby. And additionally to that, the placenta accreta spectrum bit means that it's going beyond the uterus like its wall and going like it's invading the surroundings. So that's called an abnormally invasive placenta. So my consultant came and saw me. That's of the Accreta team at the hospital that I'm at, and they had an MDT meeting, so all the consultants and everyone involved, and I will have to have a caesarean hysterectomy most likely. And what that means is that you have a caesarean section and then also have the uterus removed, just because of the level of bleeding that's involved in this kind of cases. It's just the best thing to be able to save your life, basically. In some cases, they might be able to save it depending on the location and how much is involved. So they reviewed my MRI scan images, and it's apparently too much of the placenta is involved, and the location as well being over the cervix. It just would not be possible to just remove just the bit of the wall that's been invaded and then to sew it up. And yeah, as I said before, I've cried my tears and I have come to the point of acceptance really at this point. I'm even looking forward to it. I'm so excited. I can't wait. It's now 7 weeks to the operation. I've got a date set. They will have to have a urologist involved, because in case of bladder involvement, because we don't know, but sometimes the placenta can reach the bladder and then they have to like fix your bladder as well. Or sometimes when they're trying to remove it, they might accidentally damage your bladder, and so they have to do reconstructive surgery, in which case I'd have to have a catheter for about 10 days postpartum, and then that's when they remove it. So yeah, I had the anesthetist come to speak to me as well and tell me what my options were in terms of like anesthesia. So obviously there's 2 main ones. Either you have general anesthesia, which is where you completely go to sleep, or you have the spinal anesthesia, which is where you're awake. And he was telling me that if I choose to be awake, I just have to be aware. I've had 2 C-sections before, but this is not a normal C-section. This is a longer and more major operation, and there's so many people in the room because there's a lot of like people involved. Apparently, he was saying they have to be, for example, 2 anesthetists, so that's 2 anesthesiology doctors. They have to be, usually there's 2 obstetricians, then there's going to be a urologist, then there has to be like a baby doctor as well, and there'll be a midwife. Like the team is much larger, so it's a bit more scary. Also the terms that they use, because it's like a protocol, but apparently the way they speak is that they keep talking about blood loss, which can be a bit scary, and it's to be expected. He was telling me basically like to just expect blood transfusion. That's more likely than not, because nearly most people end up needing blood transfusion. So for instance, they would say how much blood has been lost, maybe 500 mils now, 1 liter of blood loss, 2 liters of blood loss. And then when you reach a point of requiring blood transfusion, then they have to do a code red, which means blood transfusion. But when they do a code red, they have the blips that might go off. It might be a bit noisy, but in this operation they do come in with blood ready anyway. It's just they have to say these things, but it makes it even more scary. So a lot of people apparently do just go to sleep and just wake me up later. Also, additionally, the operation is much longer than the regular C-section. I think you go in at 7 or 8 and you're back to the ward like after recovery and everything like at 3 p.m. If I do have the C-section with a spinal or the way I'm awake, my partner can't come in. But if I have general anesthesia, then they obviously can't come in because that's just too traumatic, because you're not even awake. And like, what's the point of traumatizing someone? So at this point, really, I haven't yet told them my decision. They told me I can decide up to the last moment. But for me personally, I'm thinking more of going onto the side of spinal anesthesia. I want to be awake. It does sound scary, I know, but I feel like I can't wait to see the baby. And also, the C-section is scheduled for 34 weeks, which is a preterm. But that level of preterm, some of them are able to breathe on their own and they're fine, and some of them are not. You can't really know. And if the baby is requiring extra support, they have to go to special care. If they are not, then they can just come to you and have skin to skin. So for me, the possibility of having skin to skin with my baby right away is worth it for me to be awake, because that way they have a more gentler like entrance into the world, not like being yanked out of your safe space in your mom's tummy and then going under bright lights and then you're separated like immediately. I want to try and see if I can be like, and see if there's an option. I'd rather be awake so that if they're able to be okay, I do the skin to skin, start the breastfeeding, because they were able to do that with my previous baby, even in the theater. We did skin to skin. Couldn't really do the breastfeeding because she was just asleep. Actually, for hours, she just kept sleeping and was not interested in anything. So that's that about the operation. So the reason that the C-section is planned for 34 weeks is because they don't want to risk me going into labor, which I don't think I would, honestly. I've never gone into like labor before 40 weeks. With my first, I went into labor at 40 weeks plus 10 days. And with my second, I had a C-section at 40 plus 1. But anyway, they're like, yeah, they can't be risking that just because the risk of bleeding would be too much. The risk is bleeding. Like if you bleed, it can be like too much and a danger to you all. So that's why they do it at that time. I've got a bit of conflicting information, which is in one of the apps that I have says 27 weeks is the beginning of the 3rd trimester, and another app says 27 weeks is the last week of the 2nd trimester. Personally, I prefer to be in the 3rd trimester, so I'm saying I'm now in the 3rd trimester. And at this point, the baby is about the size of apparently a head of cauliflower or a bunch of bananas, or around 800 grams. They can now open and close their eyes. They can recognize day and night, even in the tummy. They're pretty much fully formed. I'm looking forward to week 28 as well, because week 28 is the week of viability in Uganda, which means that after 28 weeks is when a baby is able to be supported with special care in Uganda, while in the UK it's 24 weeks. I feel like I'm more comfortable to reach 28 weeks. And also I feel positive I'm going to reach to the end, but still every week makes me feel more excited, especially now that it's my last pregnancy as well. There's even more of those feelings of excitement. I can't wait. In terms of symptoms, I have developed worsening of my heartburn. So I've been on omeprazole 10 milligrams throughout my entire pregnancy, because even before pregnancy I have to take that to keep my heartburn at bay. But it's gotten worse. It got worse while I was in hospital because of hospital food, and it seems to be getting a little bit better now. I still have pelvic and joint pains and back pains, but that's getting better since I returned home. I think because hospital beds again are so uncomfortable. But I do have a physiotherapy appointment. I have to go back up to London because that's where the appointment was made, and see if there's anything else that they can offer me. In terms of breastfeeding, I am still breastfeeding again. Like last week, I thought, not last week, like the last update, I thought we were done with our breastfeeding journey. But when I came back home, Jojo just resumed as usual. And I was told actually ideally I shouldn't be breastfeeding. But as far as the research that I've done, most cases breastfeeding is not going to cause you to go into labor, because it releases oxytocin, but that's always happening. But what happens with the oxytocin hormone is that oxytocin will activate an already prepared uterus. Like your uterus itself should be ready like for labor to be activated by oxytocin. Otherwise, nothing much is going to happen. So anyway, I'm confident in my decision to continue breastfeeding because it's only a few times. And then also, I think it will really help me with this other baby as well. I'm hoping that it will help with the colostrum, and that by the time baby comes, especially if they're going to be in their preterm or if they're going to go in special care, I want my breastfeeding to already be established and not have to be re-establishing it as well. So I'm letting her continue. There isn't much coming out, but I think eventually there will be. So I'm happy to continue for now. I'm also also not supposed to be having sex as well, by the way, because of obviously placenta previa is like down, and then also the same risk of oxytocin release when you have an orgasm. They're afraid that it might activate the uterus as well. How tough is it? It's really tough because once they tell you that you know to do something, then that's all you want to do now. It's human nature. I've also gotten swelling of my hands and my feet. They started getting a little bit swollen. I don't usually get like super swollen, but I can feel like there's a difference. My engagement ring is too tight, so I had to take that off, but my wedding ring is still fine. Usually I can wear my wedding ring throughout pregnancy, and we'll see, but this time I feel like it's getting a bit tighter. Also my feet, but I'm raising my feet every time I'm sitting down. I raise my feet up, so that helps reduce like the swelling, which is not too much really, it's just mild. I'm enjoying feeling baby movements. I can nearly feel limbs, and it's really cool and so exciting. I feel like my tummy is a bit thinner than before. Maybe I got the diastasis, I'm not sure, which is where your muscles separate, but I can feel limbs much more clearly than I ever did in any other pregnancy. And thank you for watching up to all this way. Are you pregnant? Let me know in the comments below. How was your pregnancy? Do you have this condition as well? I know it's super rare. And yeah, let me know. Hope you're doing well and wish you all the best. Thanks guys. Bye.